Hi everybody, my name is Lauren Roberts and I'm here today to talk to you about the results of our Rare Minds Matter survey. So this is a survey that we launched for Rare Disease Day in 2023. And just before I go on to our survey, I just thought I'd set the scene a little bit. In 2018, there was a report published in the UK by Rare Disease UK, which explored rare diseases and mental health, and in particular the impact that having a rare condition had on mental health. And this was very much the kind of first survey of its kind. This isn't something that had really been looked at properly before. And then there was a follow-up paper from that initial report in 2022. And you can see here that it presented a pretty bleak picture. 95% of respondents felt worried or anxious, 90% had felt low, 70% had felt a breaking point, and 39% of patients had had suicidal thoughts. And one of the key things that came out of this report was that the challenges of having a rare condition wasn't just about the condition itself, but it was the experience of healthcare, and particularly about not being taken seriously by healthcare professionals or the kind of diagnostic odyssey and the way that that could add to the stress and trauma. Only 23% of respondents to this survey, to this report, felt that healthcare professionals considered their mental and physical health as equally important. So as I said, this presented a pretty bleak picture, and not much really changed after this. I think anecdotally, most people in the rare community recognised that this is a situation, but it wasn't really given a huge amount of attention. And then obviously the pandemic happened, and we all know that that had a really significant impact on mental health of everybody generally, but particularly for people in the rare community. And it does feel like finally things are starting to shift a bit, and that mental health is being seen as the kind of missing puzzle piece in the rare disease journey. So this year in particular feels like a bit of a turning point for rare diseases and mental health. So in April of this year, we published our survey, which I'll talk you through in a moment. But also that month, the Specialised Healthcare Alliance in the UK published a survey of their members. So they're an alliance of 140 charities and corporate partners. They surveyed them about mental health, and you can see here that 84% of their respondents described the availability of mental health support for family, parents and carers of people living with a rare or complex condition as quite poor. They had a number of recommendations, and these included the need for mental health support to be accessed in a timely and equitable way. And also they thought it was really important that mental health support was open to families and carers, that it should be delivered in partnership with charities, and that it should be offered through peer support networks. In June, I've jumped ahead. In May of this year, we also launched our Wellbeing Hub, and I'll share links to that at the end. But this is a free resource for anyone in the rare community to use to help talk about some of the mental health challenges they might be facing and help them think about ways that they might manage that. And then in June of this year, Eurodis, the Rare Disease Europe organisation, launched their mental health initiative and also their outline paper on mental health and wellbeing. And this is a really important step towards mental health and rare conditions being kind of recognised on both the European but also the international stage. And if you haven't yet had a look at this paper, I really encourage you to go and do so. It very clearly sets out a number of recommendations at the kind of national, service and individual level of how we can look to better serve the mental health needs of the rare community. And I've just pulled out one of the recommendations here because it's one that particularly resonates with us here at Rare Minds. And that's about how if integrated psychosocial support could become an integral standard of medical care, then actually this would really just help overall with promoting mental health and well-being. So at Rare Minds, we're always really clear that it's not that everybody will need access to specialist mental health support, although some will. And it's not that we want a kind of new, completely distinct service set up. Actually, we could go a really long way just through having psychologically informed care embedded throughout the care pathways in the rare community. And that would help to alleviate some of the kind of accumulated trauma that happens to people through their experiences of healthcare that then often results in them needing specialist healthcare at the other end. So here's a kind of snapshot overview of our survey. As I mentioned earlier, it was released in February 2023, and then we published the results earlier this year. And you can see here that it's still a pretty bleak picture. We really wanted this survey to kind of be a bit of a snapshot. So it's not the most academically rigorous survey, but we're pretty, we tried quite hard to make it as representative as we possibly could. There was 695 respondents and there was 188 conditions represented. It does have some limitations though, so I'll just let you know quickly what they are. Like many surveys, it was overwhelmingly white British or white people who responded. So it doesn't really reflect, or potentially doesn't reflect, the experiences of minority ethnic communities, especially ways in which their experience of a rare condition may intersect with other experiences such as poorer healthcare or racism. Also, it was predominantly it was individuals who responded with a rare condition as opposed to parent carers. So the results are probably more reflective of life with a rare condition rather than caring for someone with a rare condition. And also that many of the conditions were ones that have quite a big physical impact. So if you just bear that in mind with a lot of the results that you're seeing, these probably are more reflective of individuals who have a rare condition that's very much impacts their physical nature of things than potentially something that's less of an impact in that area. And also, so there were two parts to our survey. One was for individuals and one was for rare patient leaders who run groups or charities. And of the second part, there were more representatives of people who are running small groups. So over 50% of the responses were from people who run a very small rare disease organisation where they have 5 or less volunteers or staff, and they have a population size of less than 50 people. So having said all of that, here's the kind of the headline results. We found that having or caring for someone with a rare condition can have a negative impact on mental health or well-being. So 85% of people reported a negative impact. 41% told us that it had a negative impact on their family relationships, although 16% of people reported a positive impact, which was also really nice to hear. And many people talked about how they felt that it strengthened their relationship. As I mentioned earlier, we found that experiences of healthcare could have a really significant impact on mental health, either as a protective factor if you had a really good relationship with your healthcare provider or professional, or a very negative one. And we found that 41% of people had tried to seek mental health support independently, but the story they sort of told us was that this is very complicated. And 75% had never been offered or signposted to mental health support. As I said, we also wanted to explore what was the impact of on the mental well-being of rare patient leaders, because we know there's often a lot of overlap between people who are running groups or charities who also have personal experience, either through having the condition themselves or as a carer. So we wanted to know what was life like for them. And as you can see, 62% told us they were concerned about responding to people in crisis, and 61% were worried about sort of maintaining those boundaries and knowing it's okay to step back sometimes. So based on this, we came up with 5 key findings and 6 recommendations. The first one, the key finding feels very obvious, but we felt that maybe we needed to state it just in case. And that's that living with a rare condition creates additional particular challenges for mental health and well-being. And some of the challenges that people identified were things like worrying about the future, fatigue, lack of healthcare professional awareness, managing uncertainty, and dealing with anxiety. And it became really clear that it's a really big psychological task coming to terms with what having a rare condition means for your life. And that we think that really what people need, as I talked about earlier, is this idea of psychologically informed care, where everybody involved in the rare pathway for that person at least is thinking about what it might mean for their mental health. So that could be as simple as thinking about, if you're delivering a diagnosis, doing it in a way that's sensitive and in a place that's appropriate, so it doesn't create more trauma that has to then be unpicked further down the line. So our recommendation for this is that a holistic, integrated approach to the care of people impacted by rare conditions that includes consideration of mental and emotional well-being is essential. We also found that rare conditions affect the usually protective function played by family and couple relationships, and that this obviously has a really big impact on mental health and well-being. And this can particularly be the case in families where there might be an inherited genetic condition, and the way that that can create additional stresses and challenges and complications. So we think it's really important that individuals, couples and families are supported to manage the dynamic of rare conditions on personal relationships. We at Rare Minds are really big proponents of the idea of not just individuals counselling, but couples counselling. And we found that often if you can really support the couple to be able to rebuild and re-understand what their relationship looks like in light of the rare condition, then this is a really strong basis for everybody else in the family to be able to cope in a positive way. So I mentioned this a lot already. Relationships and interactions with healthcare professionals have a really significant impact. And one of the things that I think was one of the most significant statistics to come out of the survey was that 75% of people had never been signposted for any kind of mental health support or offered it. But when we had a follow-up question of the 25% who had been offered or signposted and said, did you take it up? 87% of people said they'd taken it up. So that shows there's a really clear demand for this. It's just that people aren't being offered. And so our recommendation is that anyone impacted by a rare condition should receive psychologically informed, rare aware care from the healthcare professionals they encounter. So that psychologically informed care might be direct, it might be having access to specialist mental health support, but it might just be indirect, as I said earlier, about people taking the time to say, how are you doing today? How are you feeling about this? Or making sure that the interactions are taking place in a sensitive way, in an appropriate place, so that they're not creating more stress and trauma for people. So we found that mental health support is desirable, but it's not always easy to access services. 96% of people told us they thought it was really important that if they saw a mental health care professional, that mental health care professional understood rare conditions. And we heard quite a lot of stories from people in the survey about how they tried to access mental health, maybe through their GP or through other mainstream ways, but that actually it was really difficult, either because the mental health professional didn't really understand their condition, so the advice they were given wasn't appropriate. Sometimes it became a barrier because the counsellor or psychotherapist didn't feel equipped to be able to support them. And sometimes also people were just told that actually maybe it was a result of their condition. So there's many complicated ways in which having a rare condition can act as a barrier to mental health support. And that's why we think it's so important that there's not only sort of access to specialist care, but general upskilling of the whole kind of workforce to understand more about the impact of rare conditions on mental health and well-being. Finally, we found in part 2 of our survey that the level of mental health support provided by rare condition groups and leaders can impact on their own mental health and well-being. And this was something we've long suspected and known through the work that we do, but we really wanted to explore more. And we think it's really important that lived experience and third sector support for mental health and well-being shouldn't be seen as a replacement for statutory provision. We all talk about in the rare community how important peer support is. And we know that the peer support groups and charities play an absolutely essential and invaluable role. There's nothing quite like the support of just being able to meet up with other people that just get it. But we have to make sure that the people that are running these groups and are volunteering for them are supported with their own mental health and well-being. They can't just be the ones that are kind of soaking up for everybody and being there for everybody else, but not being supported themselves. We need them to be able to keep going because our whole sector rests on them. So there really needs to be ongoing support and training for rare leaders and peer supporters so that we can safeguard their mental well-being and ensure that they are able to carry on playing the absolutely vital role that they play.